Well, good morning, everyone. My name is Jeff DeVerter. I'm the Chief Technology Evangelist for us here at Rackspace Technology. I'm excited to get to welcome you to the next episode of Cloud Talk Live. All right, everyone. Welcome to the program. So glad that you are here. We do this every week, but I'm always so glad to get to see you guys. So thanks for showing up again. I would love for you to introduce yourselves. Tell us who you are. Tell us where you are out in the world. So go ahead and introduce yourselves in the comments, whatever platform you're watching us on here today, and let us know. Now, if you want to get a hold of us, of course, feel free to send an email over to solve@rackspace.com. Whole production team gets those, and we would love to hear from you. How's your week going, by the way? It's been crazy over here already. Feels like it's the end of the week, but no, just a Tuesday. But I'm glad to get to spend a little bit of time with you. Now, a couple of things to make sure that you're up to speed on around here is, first of all, if we're not best friends over on LinkedIn, I'd love for you to connect with me there. Now, also, we are releasing new podcast episodes, and if you're not following or subscribed to the Cloud Talk podcast, wherever you find your podcasts, well, you're going to miss out on those. So go ahead and make sure that you are, as subscribed as you can be. Now, big things. Oh, Evie's here. So glad Evie's here. You're first to follow the instructions, Evie. Just classic Evie. All right. Also, we have big news coming up for about this time next month, May 7th. We have the next Solve Summit. As you may be aware, we go out it's been every quarter. We're going to pace that down just a little bit so we can dig deeper into some of this content. But we go out and interview over 1,420 IT decision makers all around the world, 10 different countries. And then we compile all that information together. We make it available. And I am awful jittery. I guess that's all my signal. We send that out and make it available for you guys in the form of a white paper, which can be downloaded. And then also we have a pretty darn amazing what do you call that thing? An infographic. That's right, an infographic that's available for you over at rackspace.com/solve. In fact, all of that information is available now. In fact, if you're planning to attend the event, and I hope that you are, how much more educated will you be if you pre-read it? So just head over to rackspace.com/solve, and you can download it today for the low, low price of nothing but your email. It's one of the only things that we actually ask for a little bit of content for. And look, there's even a QR code if you want to head over there and get that information. I'd love for you to go and do it. Well, as we all know, technology is making just an amazing impact in almost every aspect of our lives, and nowhere more than over in healthcare. Now, this is a pretty amazing time to be utilizing technology in these ways. Now, in healthcare, we're finding that artificial intelligence is helping to analyze, test results, x-rays, all kinds of things to help weed out and narrow and better classify information. I mentioned that's about a month and a half ago, there's a really interesting study that shows how when utilizing AI to look at scans for esophageal cancer, well, they're actually able to pre-detect that stuff better than just with human eyes. And when human eyes find it, well, there's only a 20% survival rate. So with utilizing AI, we're now able to get in and increase that to over 80%. So I'd love for you to dig into that, look at that information. But also machine learning is helping personalized treatment. Also, we're finding blockchain being used to help track and manage patient records. It's perfect for that. And then, of course, telehealth has made an amazing impact, especially when we think about how AI and technology had helped us through, little things like lockdowns and whatnot. But here to dig into our conversation of healthcare and how technology is moving that along are a couple amazing rackers. First up will be Hannah Duce. Now, Hannah looks after our alliances here at Rackspace. And what are alliances? Well, these are the most strategic partners that we're aligned to help bring together amazing solutions for you guys, our customers. Also, we have an executive in residence here. I'm really excited to bring up Jason Jones as well. In fact, enough of just looking at their studio quality pictures. Let's go ahead and bring them up onto the stage. All right, Hannah, Jason, welcome to the program. So glad that you're here.
Thanks, Jeff.
Thanks, Jeff. Good to be here.
All right. Well, Jason, I really have to lead with what's an executive in residence, and I'm pretty excited we have one here at Rackspace.
Yeah, I would say an executive in residence, I've spent my entire career in the Epic environment, right? So 15 years actually as a community member, delivering care as an enterprise architect. And then I spent the last 12 years at Dell, 100% dedicated to selling into healthcare. Supporting the Epic environment there, and I'm going on a year almost here in a couple of weeks here at Rackspace. So it's really just that in-depth knowledge of the ins and outs of Epic and how to support a large care system that's either going live or has been live in that environment.
Yeah, now we're going to come back to what the heck Epic is, because not everybody lives in this world, so you're going to get to define that. But Hannah, did I introduce an alliances leader well? Don't you introduce yourself to the world?
You did. You did great, Jeff. Hannah Duce. So I lead our alliances, as Jeff mentioned, here at Rackspace. Been here for about 5-6 years. Just working on partnerships. I've spent most of my career in some form or fashion connecting people, partnerships, organizations to really amplify whatever we may be doing here and work together for joint go-to-market, building better things together. Can't do it alone.
I love that. It's so good. Now, you guys are fresh off of a couple of conferences actually, specifically in the healthcare space. Now, as you guys know, we've been talking more and more about specific industries and how technology is making a significant impact. Here at Rackspace, we've actually built an entire division around how do we help serve these customers. Now, before we get into the conference itself, Jason, you've already talked about one of the applications that is one of the most significant and impactful applications that most people have no idea what it is, and that is Epic. Why don't you go ahead and define what that is for the rest of the world who's not deeply involved in healthcare tech?
Yeah, I think the easiest way to describe it to an individual, when you go see a clinician, a provider in a healthcare system, that interaction historically was between you and that provider. Yeah. Now that interaction is between you, a provider, and that computer. That computer is running that software called the EMR, EPR, EHR, depending on where you are in the world. But it's the electronic health record system, right? So that paper jacket that they used to walk around with all of your files and everything. Your
file, yeah. The file that followed you. Yeah.
And that's what that back end is. Providing better care and outcomes across the ecosystem.
Really, it's that transformation from the paper world to the digital world in a way that that flows even, that makes sure that data stays up to date. That, I talked about some of the AI and machine learning, use cases. I mean, there's a lot of that's baked into that to help look for the things that those care providers, as well intended as they are, and as talented as they are, they can't keep track of everything with the patient load that they have. So that helps to look over their shoulder a little bit as well and make sure that care is appropriate.
Yeah, and that AI is a little bit difficult to leverage on paper.
A little bit difficult. That's exactly right. Very cool. So Hannah, I already mentioned you guys are fresh off some conferences. Why are there conferences specifically to healthcare and healthcare technology?
Gosh, I think when we think about conferences, is bringing a community together of shared interests. Yeah. So if you bring this almost think tank together, better together, how do you come together, share, hopefully learn some things? But I honestly, this is personal, but one of the biggest values I find out of these conferences is just being able to connect, hear what other challenges are out there, what mistakes are being made, how do we not replicate that, repeat that, let's learn together and get better. So, I think that's one of the big reasons. Each of the conferences kind of have a different flavor to them, or what they're really targeting. Maybe there's a specific topic. Clearly, AI is through everything right now. It doesn't matter what conference you go to. You're going to hear it. But the use cases around that, the business cases. So, I really think it's when we saw it during the pandemic, the lack of that, you start to really lose connection with what's everybody else doing, and how do we grow together and get better. So
very cool. Well, what were some of the themes? Now, there were 3 conferences that really we're talking about, and we didn't really identify them. So there's the Arab Health, there's HIMSS, and then there's ViVE. What are the differences between these 3 different conferences?
Locality, right? Obviously, when we think about Arab Health in the Middle East, right, really focusing on delivering care there in the Arab world, right? And absolutely amazing conference and very, very different in the way that they're looking at things, all the way from, whether it's sterile tools, through the EMR stuff, right? So all aspects of pharmaceutical manufacturing, across the board, and just massively, massively attended. Amazing conference, right? And in the sharing, what actually was most surprising, I think, for me this year at Arab Health, this was my 5th time at Arab Health, was the number of U.S. healthcare systems that actually had booths where, they're extending their, oncology department, right? They have some really, really amazing providers that are doing some crazy cutting edge type delivery, and bringing that into other environments, right? Other areas of the world, and really sharing that knowledge and sharing that data. So that was very interesting. HIMSS, the last one we went to, one of the largest shows, on earth. And that's a global presence that brings everybody together, right? From a provider, from payer, life sciences, across the whole spectrum. But with ViVE, just a little bit different, right? Smaller, a little more intimate setting, just trying to help educate the different individuals that are inside of the healthcare organization, just in a little bit different ways, right? So very much tailored for those attendees.
Now, one of the, as we think about healthcare technology, there are different trends, of course, that exist throughout all areas of technology. One that's pervasive throughout healthcare, but also literally every other industry, is the challenges that folks are having with talent. It's finding the right talent for the right job at the right time, keeping the talent. You guys know the challenge. If you're a technologist here, you're reaping, in some cases, the benefits of that, being able to, continue to look for and find, challenging and amazing work. But one of the other areas, and Hannah, you brought this up before, and that is you really can't step out of your door to go to anywhere and not hear about the topic of AI. And we think a lot about AI, especially as we get into specific industries. We go to, the scariest, the worst, the most exciting use cases. I think AI, and we think healthcare, and we think, ooh, are the robots going to do heart surgeries? Well, the reality is AI, like in all industries, is having significant impacts in areas really from the ground up. And one of those is just in administration tasks. Hannah, maybe you can touch a little bit on areas where you're seeing AI in healthcare specifically having an impact that is ultimately creating time or resources to then be able to be leveraged in patient care.
Sure. Yeah, a few examples. Administrative tasks, kind of straightforward and can be used across industries, but whether it's streamlining appointment scheduling, claims processing, data entry. So lots of ISVs growing in this space as well that can really complement what organizations are doing. So when we think about that, we touched on, I think, image analysis. So that can be another area that, AI is really helping to analyze various studies, improve accuracy, help detect abnormalities that wouldn't have been seen otherwise at a much faster pace. And then another area might be chronic disease management. So supporting patients with these chronic diseases, these conditions, to help personalize the self-management and care of those. And Jason probably has some other examples too. You could keep going.
Yeah, Jeff, I would love to touch on that topic of AI, right? Because we are talking about delivering care. We are talking about people and patients, right? And I think the administrative side is a great place to start. When you think about some of the challenges in healthcare, right? WebMD, everybody becomes a doctor because they have Google in their pocket. And that's really not the case, right? Clinicians and providers go to school for a long time to learn how to practice medicine, right? And so really from their perspective, there is a nice opportunity for AI to help, But if they don't understand how the AI got to the decisions that they got to, they don't necessarily trust it, right? And so I think that is probably our biggest challenge when we start to deliver care in the AI space is open it up. Allow me as a clinician or a provider to understand what data you took from where to get to the point you did, because then I can trust it, right? If it's a closed black box and it's just, oh, trust Hal, I don't know if I'm going to trust Hal, right?
Well, another area where it's being used a lot, and Jason, with your history in and around the healthcare industry from a technology point of view, is how it's helping not only with cybersecurity, but then there's the greater threat with cybersecurity that exists everywhere in the world, but of course nowhere more than the impacts that can be felt in and around healthcare. So let's talk cyber for a minute, Jason.
Yeah, yeah. And sadly enough, we had a major security event right as the time of that we are all in this vertical have been living through, right at the ViVE time and HIMSS time, and bad actors taking control of data, demanding large amounts of money, and the impact of this one was across the entire delivery system, right? Like it wasn't an isolated single system; it was every prescription provider across the United States, right? Like it was very, very, very large. And it's a very expensive record, right? When we think about, your banking statement, sure, there's a few pieces of information. When you think about a medical record on average, right, each per record's about $90 a record on the dark web. So this is a really high attack profile. When you think about, medical history, all of your, personal information, right? Think about stealing an identity from an individual. What better place than to do it with a medical record? Like you have the entire history, and you can, sell that to the highest bidder, and that creates just exponential challenges across healthcare, right? Because we don't necessarily have the strongest, most, highest level of security historically, right? I mean, technology is sadly not the forefront of delivering care, right? Like it's integrated across the entire care system, but it's insurance, right? It's those things that we don't need it until we actually really need it, and so we try to skinny it down as much as we possibly can, right? And I think that what we've seen over the last, I would say, 12 to 18 months is a massive refocus on healthcare cybersecurity, right? And really trying to understand how do we do this better?
That's right. So, we mentioned earlier, we talked about Epic, and Sean in the chat here asked us, well, like almost a leading question because it's such a good one. Epic, of course, has their own cloud-based solution,
Correct.
as many companies do, SaaS-based offering. It's not the only way that a company can go, but he's asking the question about what is the lift? I mean, if we're talking about these records that are, well, they're golden. I mean, you've got to protect them. You've got to make sure that they are, that they stay intact, that nothing gets disturbed in them. What does that lift look like when moving from an on-prem Epic deployment up into a cloud-based environment, or anywhere else for that matter?
Yeah. So when you think about, the lift of an Epic environment, right? So I just so everybody knows on the phone here, one of our positions at Rackspace is Epic Hosting as a Service, right? So we're the largest third-party Epic hosting provider in the world, the largest private cloud provider in the world, right? So we have over 150 certifications of 60 different individuals, 60 plus individuals in that Epic ecosystem, right? So
what you're saying is you know what you're talking about. Let me just spell that out.
We bring the powerhouse, right? This isn't just empty words, right?
You didn't read a white paper, and now you're here to tell us how to do it.
I slept in a Holiday Inn, exactly. So the lift is it's a project, right? It absolutely is a project, right? And from our perspective, private cloud gives you all of the safe haven that you would on the on-prem, but it gives you that cloud capability, right? That fully managed service. Public cloud can provide some of that elasticity and things, but when you get down to predictability of cost, and those types of things, some of that goes out the window, right? So the lift, it's a standard project plan of a migration, right? Whether it be a migration from, your primary data center to a different data center, it's the same project that we would walk through. So it's really not that big of a lift to get it there. um, Pros and cons. I love that idea around pros and cons, right? And the cloud of the mobility, portability, and elasticity, and all of the things that the public cloud promises. They also promise to not really dive into defined costs and high availability SLAs, right? So those are something that Rackspace in our private cloud environment, 5 nines of availability. The tagline from one of our customers, right, and it kind of sounds cheesy, 5 nines of availability at an affordable price. But really, that's what it comes down to, right? That is our offer. And I think we're also very unique in part of the reason, most of the reason that I'm here at Rackspace. Hosting's not new for us, right? This is what we do for a living. So all of the and in your organization, right? The other things that are out there, we've been doing that for 25 years, right? So now, like you talked about earlier, this focus on verticalization and really diving deep, bringing a ton of subject matter experts in this healthcare field, right? We're the Epic and everything else, right? So it's not, hey, go find a place for this. Oh, and the other 1,100 applications, figure that out too. And that might be 5 or 6 different contracts. We're the single hand to shake. And that's really a unique position for us in the market, right? We don't have to send you elsewhere for other services.
So true.
That's a huge pro.
It is. So Hannah, I'm going to bounce back to you for a second as the Alliance leader here at Rackspace. How does that Dell Alliance help with these solutions?
Yeah, I think that was a perfect lead in, Jason. And again, we'll go back to the if you take Epic, crown jewels of an organization. And so the complexity of that and the depth of knowledge needed, we can have that, and then we amplify it and deepen it through our partnerships. So Dell, leading player in the healthcare space, so working in partnership and in concert with their technologists as well to help as we encounter new challenges. And we standardize as best as we can to make this as efficient and provide the best level of service. But every customer has some unique challenge that we need to face, that we need to consult through. And so when you've got the depth of knowledge from a partner like Dell, you kind of can't get better than that. And then you add in all the other partnerships that we can build out an ecosystem around for all of that. And so we talk about all these peripheral workloads that come with it and that need to be interconnected and tied in and adjacent to Epic. And then we start to work with different ISVs and really build out that ecosystem through our partnership network. I mean, that's when you're able to be that one hand to shake, because one organization in and of themselves cannot do all that is required in this space on their own. So you have to have deep partnerships and you have to have trust with those partners. And so that's what myself, my team, that's what we're kind of tasked to do, is to go build that out on behalf of our customers to best deliver the service that's needed and face these challenges together. So I hope that helps.
It does. And I much prefer the phrase one hand to shake than one throat to choke. That is a much more pleasing way to think about that. So well said on that. So we're coming towards the top of the hour, which means we need to start to wrap this up just a little bit. But what I'd love to hear from each of you in a relatively short amount of time would be, what's one of the key takeaways that you took from those conferences? So Jason, we're going to start with you. What'd you learn? What was the big takeaway? What made you think about the world a little bit different now than you did before?
It never surprises. I guess every time it surprises me, just the sheer scale of the healthcare ecosystem, right? And it continues to grow and grow and grow. And if you want to get into this business or any business, just slap a .ai on the end of your name and show up at a booth, and you'll have some stuff ready to go. But no, in all seriousness, just the scale of opportunity to really solve the challenges in our delivery systems today, right? our providers, you talked about burnout, you talk about all of the other challenges, and that goes all the way into their business model as well. I think, the reality is that they don't have time to look up and search for these problems. And so seeing people that are helping to just drive healthcare forward, at some point, it's a parent, it's a sibling, it's a spouse, it's a child of each one of ours at the other end of that delivery system, and our goal is to provide the best possible care, period, right? So
I love
that
it.
it just I love that mission, that more and more people continue to get behind that and just drive this delivery system forward.
I love it. Hannah, big takeaway from the conferences.
Oh gosh. I mean, I'm going to keep on my alliances track. I've had multiple conversations since meeting some of these different potential partners at the conferences. So I've also been really excited by, our partnership with Dell around Dell Alliance's healthcare cloud and the ability to scale that outside of where we've started a handful of years ago with them and building that out. So, and that includes bringing in interoperability through a partner like LK, and just those connection points we've been able to have at these conferences, and then the follow-up conversations around what do we do different. We've heard a lot of the similar challenges that are ongoing. How do we face those in a different way? Use something new. Maybe it's one step to be able to do something different in this next year before we meet again at the next round of conferences. So
That's good stuff. All right, folks, top of the hour here. Hopefully this has been enlightening for you. Some of the technology that helps make the healthcare system, well, not only run, but hopefully be more efficient and help serve humanity better. Now, if you'd like to learn more about how Rackspace can help you or your organization in this space, there's going to be a QR code up there that will take you over to learn more about what we're able to do. So, Daniel, if you wouldn't mind bringing that up onto the screen while we finish up here, that would be fantastic. I am really grateful for both Jason and Hannah being a part of not only the organization and delivering the amazing services that they do, but of course taking their time to be with us today. All right, Daniel, if you could bring that QR code up one last time, that would be super fantastic as we close out our time here today. Everyone, we are back here every Tuesday morning. We're working on a great one for you for next week. I hope that you will join us for that back at next Tuesday, 8:30 a.m. Central Time. There it is, the QR code. If you want to learn more about healthcare services at Rackspace to host your Epic or other softwares in a private cloud or even public cloud environment, Rackspace is here to help. And there is the QR code. Folks, hope you have a great rest of your day. My name is Jeff DeVerter, Chief Technology Evangelist for us here at Rackspace Technology. Thanks for taking some time with us here this morning. We'll see you next week.